So there are a number of key Pilates principles that you need to understand before you start any Pilates workout. The first of which is this idea of getting your pelvis into a neutral position. And the reason this is so important is because your core muscle is only effective at contracting when you are in a pelvic neutral position. So if you start to lose that neutral pelvic position, then you'll lose your core contraction. So the best way to try and think about this pelvic neutral position is just to position your hands on your pelvis and imagine your pelvis as a bucket full of water. So you want to first of all, to find this neutral set, pour some water out the front of that bucket so you actually feel your tailbone lift out behind you and you're arching your lower back, and then you tuck your tailbone under, so you think about pouring some water out of the back of that bucket. And you would do that perhaps a couple of times until you feel ready to come and set your pelvis in that midway position. So you're setting it somewhere between the two extremes of movement. And again, if you think of this idea of this pelvis being a bucket full of water, when you're setting it level and neutral, you want to imagine the water being full to the brim, and that's where that level position is. So that's your pelvic neutral position. The next thing to remember is the ribcage placement. So you want your ribcage to connect down with your pelvis. So you don't want to feel as though your ribs are flaring up away from your pelvis. You want to connect them down and just almost imagine these abdominal muscles between the ribcage and pelvis just helping connect the two areas. The other thing is the shoulder blade placement. So you want to just imagine the tips of your shoulder blades pulling down towards the base of your spine. So that gives you that feeling of widening out through the chest just to set the upper body. The head and neck position as well needs to be considered. So you always want to just drop that chin down, and you almost want to visualize here the earlobes just dropping down behind your collarbones, so giving you that feeling of length through the neck. We talk a lot about lateral breathing in Pilates as well. So the breathing technique does again assist this core muscle in contracting, and it just gets the diaphragm working. So when we talk about lateral breathing, we actually want you to breathe into the base of your lungs out to the side. So you want to feel the ribcage expanding laterally. So you can almost here visualize an elastic band wrapping around your lower ribcage. And as you take your lateral breath, you want to imagine trying to snap that elastic band. So it's that big deep breath into your lungs, out to the side. The other thing you can try and do to practice the lateral breathing is placing your hands together on the lower part of your rib cage, getting your fingertips just to touch. And then as you take that lateral breath in, you'll feel the fingertips just separate. So again, it's that feeling of separation and that feeling of the rib cage expanding out to the side. So when we talk about taking a deep breath in Pilates, it's that lateral breath. So a really big deep breath into the lungs. Also then thinking about activating your core. Now there's a couple of ways that you can think about this. The first of which would be to contract your pelvic floor muscle. So your pelvic floor muscle is the muscle that if you are desperate for the toilet, that's the muscle that you are using to hold and control the bladder and the bowel. So if you just try and think about lifting that inner pelvic floor, so lifting the area between your pubic bone, your tailbone and your sitting bones, you're just lifting that up. If you find it difficult to think about a pelvic floor contraction, the other way that you can think about activating your core is to draw in this lower abdominal area. So this area here between your belly button and your pubic bone, so this lower part of your tummy, you're just trying to attempt to pull that in towards your spine without letting the spine move. So remember, you don't want to lose that pelvic neutral position. So you're just gently pulling that lower abdominal area in, and you want to have this subtle feeling of tightening just around that lower part of your tummy. So when you're doing your Pilates workouts, if you can try and remember just all of these principles of maintaining a neutral pelvic position, maintaining this lower abdominal or pelvic floor contraction, and just sort of thinking about that fluid movement without losing any of these key principles, then you should manage absolutely fine with the workouts.